Hi, sir. Good evening.
Hi, good evening.
So one question.
Yes.
What is the different kinds of dialysis?
There are two primary and two secondary types of dialysis: hemodialysis, peritoneal dialysis, hemofiltration, hemodiafiltration, and intestinal dialysis. First, hemodialysis. In hemodialysis, the patient's blood is then pumped through the blood compartment of a dialyzer, exposing it to a partially permeable membrane. The dialyzer is composed of thousands of tiny synthetic hollow fibers. The fiber wall acts as a semi-permeable membrane. Blood flows through the fibers, dialysis solution flows around the outside of the fibers, and water and wastes move between these two solutions. The cleansed blood is then returned via the circuit back to the body. Ultrafiltration occurs by increasing the hydrostatic pressure across the dialyzer membrane. This usually is done by applying a negative pressure to the dialysate compartment of the dialyzer. This pressure gradient causes water and dissolved solutes to move from blood to dialysate and allows the removal of several liters of excess fluid during a typical 3 to 5 hour treatment.
Second, sir.
Second, peritoneal dialysis. In peritoneal dialysis, a sterile solution containing glucose is run through a tube into the peritoneal cavity, the abdominal body cavity around the intestine, where the peritoneal membrane acts as a semi-permeable membrane. The peritoneal membrane or peritoneum is a layer of tissue containing blood vessels that lines and surrounds the peritoneal or abdominal cavity and the internal abdominal organs, stomach, spleen, liver, and intestines. The dialysate is left there for a period of time to absorb waste products, and then it is drained out through the tube and discarded. This cycle or exchange is normally repeated 4-5 times during the day. Peritoneal dialysis is less efficient than hemodialysis, but because it is carried out for a longer period of time, the net effect in terms of removal of waste products and of salt and water is similar to hemodialysis. Peritoneal dialysis is carried out at home by the patient. Although support is helpful, it is not essential. It does free patients from the routine of having to go to a dialysis clinic on a fixed schedule multiple times per week, and it can be done while traveling with a minimum of specialized equipment.
It's very useful, sir. Thank you, sir.
Thank you.